I'd like to introduce Gayla from the United States. Welcome, Gayla.
Thank you.
Could you tell us the reason why you take LDN?
The reason why I started taking naltrexone was because in 2005 I was diagnosed with carcinoid cancer. I had done some research and had found that naltrexone actually can help build the immune system. And so my doctor started me on it, I believe in 2006.
How old were you at the time?
51.
So how advanced was your cancer at that time?
The type of cancer that I have, you can have it for many, many years and not even know that you have it. Mm-hmm. And so they had predicted that I had had this cancer, this tumor, in my large intestine for at least 10 years before I was diagnosed. Unfortunately, because it was there for so long, it had metastasized into my liver. That's why I had to have surgery, and then I had chemoembolization, which pretty much wiped out my immune system.
How long did all that surgery and things take?
The surgery I had in January of 2006. I was in the hospital, I think, a week with that surgery, and I actually had to have 6 organs removed during that surgery. And then the chemoembolization, I was in the hospital for 5 days. Between the surgery and the embolization, it really took its toll on my immune system. So then that's why my doctor started me on it.
So just your regular doctor that prescribed you the LDN?
My doctor is a DO. He used to work in an ER in the hospital. Even though he's a DO, I mean, he can do Western medicine, but he leans towards alternative medications and treatments, and I mean, he's not afraid to think outside the box.
So what is your health like now?
My health is pretty stable right now. You know, I've been using the naltrexone ever since then, and even after, you know, once I started using the naltrexone, and I believe I was taking it about a year, my doctor actually did do another sort of outside-the-box treatment. It's called urine therapy. I would take the naltrexone orally, get it into my system, and then collect urine, and then they would filter that through a needle, and then they would inject it back into my body, so that I was sort of getting a double dose, mm-hmm. if you will, to continue to boost my immune system. And then after I went to Switzerland 3 times in 2008 for Y90 and LU-177, then my platelets and my red blood cells took a huge hit. And so that's when my doctor started me on doxycycline, 5 milligrams compounded. And so I continue to take the naltrexone and the doxycycline. I take Nature's Steroid for my thyroid, and these are all compounded drugs. So up to this point, my health is probably better, way better than when I first started this trip. So I just continue to do everything, right. Because I've tried to stop a couple times, and so I always falter a little. So it's like, well, I can't stop, so I take it.
Did you find any initial side effects for starting the LDN?
The only side effect I have found with the naltrexone is that when I first got it, tried taking it at night, like they recommend, and I was up for like 3 days. We started backing it off like earlier, mm-hmm. and about the latest I can take it in is probably around 1 o'clock in the afternoon. If I take it much later than that, then I can't sleep. I can't sleep at all. So that's the only side effect that I have felt from it. I don't feel anything.
What dose do you take?
4.5.
Right. Mm-hmm.
Yeah.
What would you say to other people with your condition that are considering trying LDN?
I would encourage anybody to try it. To my knowledge, I've not heard of any bad side effects. I don't know of any long-term bad effects from it. I think from taking it, all you can do is gain health benefits from it.
Mm-hmm.
And I've encouraged people, I've tried to encourage people for a long, long time to at least try it, to get their immune system built up. It's like once I find something that works for me, I know things don't work for everybody because we're all so different, but I know this drug has been shown to relieve a lot of different illnesses. So I think it's worth a shot.
Well, thank you very much for sharing your story with us. Thank you.
Oh, you're welcome.